Hi, my name is Camry AG, and I will be discussing the understandings of the concepts transference and countertransference. Both concepts are very important when dealing with social work as well as therapy practices, as it can influence a certain type of client worker relationship. Transference is usually described as when a client unconsciously redirects their emotions or feelings from something that happened in their past onto someone in the present that is now trying to help them or in some way continue to guide them to help them grow. And an example of that would be maybe a parent abandoned them when they were young. And so now they have developed this fear that anyone that's trying to help them may leave soon. And that causes some type of disturbance, and which can usually create some challenges, but it can also give the worker an insight into some of the unresolved conflicts or unmet needs that the client may need to be brought up so that it can be addressed in treatment. When dealing with countertransference, on the other hand, um, it's more so taking the client's emotions, the redirected emotions or feelings, and somehow connecting it with the worker or your own personal experience. And just an example of what that looks like, it could be maybe you're feeling very overprotective of a kid that's in foster care, and that's because it reminds you of the time that you spent in foster care when you were younger. So you understand what it feels like to be scared or to be angry that you're even in that situation. And so you're connecting something that happened with your past with the type of trauma that has happened in that client's past as well, which can also cause some challenges when dealing with countertransference, because it could blur professional boundaries just trying to connect on that level. So you just want to make sure that whenever you're having these type of connections with a client, that you're setting boundaries to make sure that it's strictly professional and that you're not trying to connect too much. Ultimately, both transference and countertransference kind of highlight the importance of self-awareness, ethical boundaries, and just being able to use your power to guide them and look over them as they're going through these challenges so that you're able to take these unmet needs or these unresolved issues or conflicts and being able to put them in the treatment so that these things can be worked out. A lot of times, even therapists can miss the idea that countertransference is also an unconscious thing, and you kind of don't realize it yourself that you're taking certain situations from your past and tying it with the the client's past. So you just want to make sure that you're taking these steps and you're realizing that as well as good as you can connect with the client, you also want to make sure that there's boundaries so that you're able to help them grow in the right way. Thank you.